Let's head to the Upper East, where, like I indicated earlier, they've recorded now 8 cases. One person has died. Correspondent Albert Sori is on Skype. Hello, Albert.
Hello, Gift.
What more do we know about these cases?
Right, so these new cases, the information came out this morning that we've recorded 4 more cases. Remember that the Upper East region, we recorded our first case on the 3rd of April, which involved a woman. Now, following contact tracing of that woman, 3 more cases were recorded on the 11th of April. And as of yesterday, information was that we've recorded 4 more cases. Now, the information we have is that these 4 cases include a woman who we are told has died. From the information that we have, just to read it for you, she's a non-diabetic from what we are told, and so she died shortly after her sample was taken before the doctor, her case was out this morning. Now, the Upper East Regional Health Directorate is this information this morning. So our case count now in the Upper East region is 8 cases. This means that we have 4 new cases, and they've also done a breakdown of the cases. Out of the 8, 4 of them are now male and 4 are also female. Now, this woman who has passed on, we are told that she didn't have any contact with anyone prior to her case as far as the investigations are concerned. But the 3 other people who are included are still, contact cases of the first case that was reported on the 3rd.
All right. So I'm seeing here also from the statement that you got, we're getting from the health authorities there, that the 3 of the new cases had contacts with the first case. Now, the first case was the pregnant woman who went to the Bogatanka Hospital. The
exactly
3, do we know who these 3 cases are? Are they health professionals who worked with her or who treated this woman, or are they random people in society?
Yes, so if you go down the statement that the Health Directorate has released, they are saying that 2 of the new cases are healthcare workers, and that is all the information they've given. They haven't stated where these health workers are, but then they've made it clear that the 2 of the new cases are healthcare workers. What they've also said is that out of the 8 cases, 7 of them are now people who are from within the Bolgatanga municipality, and the other one, she's the woman that has now died, is from the Boko municipality.
Very interesting details there. We're also seeing here again that they've deployed contact tracers to do the mapping. Do we have any further information on that?
Yeah, so one of the difficult things with this COVID-19 cases in the Upper East region is actually getting the healthcare authorities to comment on the cases. For instance, I got this statement earlier today, but just getting the health director or an authority from the health directorate to give details has been very difficult, mainly because they want to try and manage the information as much as possible so that you don't have misinformation circulating in the public. And so eventually I got the regional health promotion officer to confirm that this statement actually came from the health directorate. But as far as getting someone within the health authority to give more details on these cases is concerned, it's been very, very difficult. Apart from the statement, there hasn't been any engagement with the press to give further details. And in fact, that is causing some sort of frustration for most journalists in the region, because for some reason, information is not very forthcoming. And if you don't make so much effort, you get very little information.
Certainly understand that. We're also getting the information they put out, at least the ones what we have to work with, is also that one of the cases says out of the 4 new cases, 2 are currently being prepared for admission, but 1 was translocated by air to Accra for care. Well, do we know why this had to be done?
Yeah, so when I read the statement the first time, my immediate reaction was to try and get the health authority to tell us if maybe this person was in a critical condition or why they needed to transport him to Accra. But again, we haven't had any information on this yet. I'm getting the sense that this person may have been in some sort of critical condition, and that is why they had to transport him. But we still need the health authorities, the regional health directorates, to actually confirm this information for us. But again, we are going to have to wait for some time before they come forward with it. But one thing, again, Gifty, that is raising some concerns among the people of the Upper East region is that since we started recording cases, sometimes some of the information, in fact, there was a case where laboratory results of some of the patients who were tested were circulating on social media. And, you know, we had people complaining about this. We needed to get the health directorate to speak on it as well. They didn't say much on it. They didn't even know if the leak came from them or someone else leaked this information. Again, yesterday, there were some, messages circulating on social media with details of the name of this woman and the statements purported to be coming from the Boko hospital. Now, a lot of people think that these are confidential information that shouldn't be circulating on the media, but it seems to be happening. And so it's causing a bit of apprehension amongst people in the region, because for some reason, the health directorate is not speaking much on these cases. All they do is release a statement, and then it creates a problem where people have to speculate for themselves.
Albert, thank you for that update there. We'll certainly be getting back to you, and hopefully there'll be a press conference or so here in Accra where we'll get better and further particulars. But speaking of statements, as Albert said, the one that was released following what happened in the Upper East also talks about challenges, significant challenges with PPEs that health officials they are facing, and it lists them. It lists the challenges. It says inadequate PPEs, no funding for risk communication and community engagement activities, shortage of swab sticks and viral culture media for sample collection, increased turnaround time in KCCR due to lack of a testing facility in the region that's in the upper East region, because they'll have to take all their samples to Kumasi since there's no capacity to test there. Sample transport to KCCR too expensive for regional health directorate. Vehicle goes to Kumasi almost every other day. And media interference with case numbers reporting. Well, we report what is given us, for example, what we have in this particular statement. So these are some of the challenges that have been listed there by the authorities, health authorities. They're dealing with this situation, and they also have way forward as well. We'll be following up on authorities so we can hear from them really what the situation is and what they're doing about it, especially when it comes to PPEs and swab sticks, as they're complaining about it.